Welcome to The Explainer. Today we're breaking down one of the most common and most critical conditions you're ever going to manage, hypertension. You'll see it every single day. The question is, are you ready to master it? Let's dive in.
So here's our game plan. We're going to start with the sheer scale of the problem, then trace the path of destruction it leaves behind. From there, we'll get practical, nailing the diagnosis, doing a smart workup, and finally, building a rock-solid treatment plan.
All right, first up, let's talk about why we call this a hidden epidemic. It's easy to overlook, but the numbers are just staggering.
Get this, 90%. That is the lifetime risk of developing hypertension for someone who's clear of it at age 55. Just think about that for a second. For pretty much all your patients, it's not a question of if, it's a question of when.
And the stakes, they couldn't be higher. This is right up there with smoking. So every single time you manage a patient's blood pressure, you're not just treating a number. You're on the front lines, actively preventing death and disability. It's one of the most impactful things you'll do.
So here it is. This is your new line in the sand. Remember, the 2017 guidelines dropped this number for a very good reason, to catch this thing earlier. Think of 130/80 as the early warning system, the alarm bell that tells you it's time to act before the real damage starts to set in.
So why are we so obsessed with that number? I mean, what's the big deal? Well, because that sustained pressure kicks off this devastating chain reaction throughout the body. Let's follow that cascade and see exactly where it leads.
Think of the body as this incredibly complex, high-tech machine. Hypertension is like a crude plumbing problem. The constant high pressure relentlessly hammers the most delicate pipes, the tiny blood vessels in our most vital organs. It's a multi-system assault, targeting the eyes, the brain, the heart, and the kidneys.
And here, this is what it actually looks like. It's incredible. You can literally peer into a patient's eye and see the damage happening. See that AV nicking? That's an artery, hardened from high pressure, physically squashing the vein underneath it. It's a direct window into the vascular war zone that's happening all over the body.
Okay, this next part is absolutely crucial. Because everything we've just talked about, all the diagnosis and treatment, it all hinges on one simple thing: getting the blood pressure reading right. If you mess this up, everything that follows is built on a faulty foundation. This isn't just a task, it's a diagnostic procedure.
You've got to follow this procedure to the letter. Every single step here is designed to remove variables, to strip away the noise so you can get to the patient's true baseline pressure. This is how you avoid misdiagnosing someone and putting them on medications they don't actually need. And you'll see these mistakes happen all the time. Be vigilant. A cuff that's too small is a classic error, and it can artificially pump up a reading by 10, even 20 points. That's enough to push someone into a different diagnostic category. Precision here prevents massive errors down the road.
Now this is huge. You have to know the difference. White coat hypertension can lead to over-treatment, sure, but masked hypertension, that's the really sneaky one. The patient looks great in your office, but at home, their organs are taking a beating day after day. This is exactly why out-of-office monitoring is the gold standard.
So you've confirmed the diagnosis with accurate readings. The work isn't over. In fact, it's just beginning. Now, you put on your detective hat. Your job is to uncover the why behind the number and to build a complete picture of your patient's risk.
This is your roadmap for that initial workup. And please pay special attention to that first bullet. About 1 in every 10 patients has a secondary, potentially reversible cause. Finding that isn't just managing a disease, it's potentially curing it. That's a game changer.
And one of the first places to look for a reversible cause? The medicine cabinet. You have to take a meticulous history, and I mean everything. Over-the-counter meds, herbal stuff, the works. That daily ibuprofen for arthritis or the decongestant for allergies could be the primary villain driving their high blood pressure.
All right, we've got the diagnosis, we've done our investigation. Now for the most important part. What are we going to do about it? Let's build a treatment framework that turns all this data into real, life-changing action.
Before you even think about reaching for the prescription pad, you have to start here. Lifestyle modification is the absolute cornerstone of treatment. And look at these numbers. They're not trivial. The DASH diet alone can drop systolic pressure by up to 14 points. That is more effective than the starting dose of many medications.
And this is the point you need to hammer home with your patients. These changes aren't just good ideas, they are powerful medicine. You should prescribe a change in diet with the same confidence that you prescribe a pill, because the evidence is just that strong. Now, when lifestyle changes aren't enough, these are your big four. For most patients, your first choice is going to come from one of these classes: They're all proven to reduce the bad stuff, heart attacks, strokes. Your specific choice will often be tailored to the patient in front of you, like an ACE inhibitor if they also have diabetes.
Okay, one last critical distinction you have to know cold: urgency versus emergency. The key isn't the number itself, it's the presence of acute, ongoing end organ damage. Urgency can often be managed slowly as an outpatient. An emergency, that's a trip to the ICU for IV meds right now. Get this wrong, and the consequences can be catastrophic.
So here's the bottom line. Hypertension isn't just a number. It's a ticking clock that silently damages the body. But the amazing thing is, you have all the tools to slow that clock down, maybe even stop it completely. Your attention to detail, from the way you take a pressure to the way you counsel your patient, can literally add years, good, healthy years, to their life. So the real question is, how are you going to use that power?